Greetings and salutations, fine people. I'm Patti Alvarez. Welcome to The Good Soul, a show where we'll have supercharged chats with everyday humans from all walks of life and unpack what in their story will inspire us all. We'll extract the untapped wisdom, distill it, and serve it up to you in all the right ways that will engage, enlighten, and most of all, inspire growth within your soul. I think people are awesome. So join me on this journey through the hearts and minds of ordinary people to uncover the good soul within you. This is The Good Soul. A warm and witty welcome to The Good Soul. I'm Patti Alvarez, and this is episode 80, Hormones, Health, and Harmony, Finding Balance in Midlife with Liz Skalsky. Today we're talking about something everyone feels, but not enough of us talk about: the hormonal and emotional shifts of midlife. My guest, Liz Skalsky, is a women's health nurse practitioner and founder of OVA Women's Health in North Carolina. After 25 years in traditional medicine, Liz created a space where care feels calm, personal, and deeply human. Together, we'll explore how women can rediscover balance, confidence, and joy through every stage of life. So Liz, let's do it.
Let's do it.
Welcome to the show, Liz.
Thank you so much for having me.
Aw, thank you for being here.
Yes.
See, well said, well said. Everybody comes in like, oh, I'm so nervous. And I know it's going to be like smooth sailing.
It's going to smooth sail.
Smooth sailing, yeah.
Yes.
So let's talk hormones. You
Let's
spent
do it.
25 years in women's health and then built OVA from scratch.
Yes.
So what made you take the leap from traditional medicine to entrepreneurship?
And it's a big leap.
It's a big
It's
leap.
a
Two
big
very
leap.
different jobs.
Yes, two very different jobs. There just came a time that, being in the traditional medicine model and this, Western healthcare approach that we're in, all patients and women, since that is my specialty as a women's health nurse practitioner, don't have enough time with their providers, and we can't get to the core of the whole person problems, because it's not just hormones, right? It's health and wellness in general. It's mental wellness, it's emotional wellness, it's the sexual health piece, the hormones,
the weight gain,
like you name it.
Did you work in a traditional OBGYN office?
I did.
Okay.
So before I became a nurse practitioner, I was a labor and delivery nurse for about 12 years or so.
Okay.
Went back for my master's, and I've always been in women's health. I've just felt this connection and draw to women and a need to serve women. Yeah. And I wanted to, get into a role where I can have more of a direct change and impact health. So that's what led me to take on, the nurse practitioner role.
Okay.
And I worked in a gynecology office for 10 years.
Okay.
And we did full-scale gynecology from adolescence through menopause, and 15-minute appointments just don't work.
Yeah, that's so interesting to me. So I didn't know about the labor and delivery. I think that must have been really exciting for you too, not to go off topic.
Yes, well, no. And it was, that bonding that you have with patients when you are there to help them birth their children is just something that is, it was wonderful.
Did you ever see like a kid in Harris Teeter and be like, I delivered that kid?
I did not, but I still have patients and friends that reach out. In fact, one reached out when she saw the live, post that, hey, OVA's live. And I opened my own thing. She's like, I still think of you to this day.
You reach your soul with your eyes.
That, you and you bringing that child into the world with me is an experience that I'll never forget. Like the connection we have. And I haven't seen her in 15 plus years.
Sure.
But
so did you work with the doctor and then go to the hospital with them, or were you always in the hospital and you were just there with the catcher's mitt?
I was there the whole hospital experience.
Hospital
we had this thing, that said the nurses usually run the show in labor and delivery anyway. We just say like, hey, I'm ready.
Yeah.
We're ready for this baby. And,
I feel like that's in all medicine.
It is.
Especially in the hospital experience.
Yeah. Nurses are there to, to educate, you
Yeah.
know, to give the care. You know, we're kind of there for the family dynamics, like the
Yeah.
entire thing. So,
And to keep it all together
yeah,
for the health, for the experience of the patient,
Is,
for the I mean,
yes,
I'm a
Manny with the
patient.
MS,
I
God knows.
appreciate the nurses so much. It's, it's the
yes,
craziest thing. They do everything.
yes.
You know,
Yeah.
doctors come in, they spend an hour or whatever, not even an hour.
She just said 15
Yeah,
minutes.
the
Yeah.
nurses are there the whole time. They're
Yeah.
the best.
Yep.
So, you describe the practice as almost like a sanctuary for women, which I
Mhm.
love. So, what do you want women to feel the moment they walk in and have
Just
this
relax, like we're talking together. Like,
Yeah.
let's talk about what are your main issues. What do you want to do to improve your health?
Mhm.
And, you know, instead of 15 minutes and hurrying people out the door,
Yeah.
we've got, you know, an hour for our first visit together.
Mhm.
And, you know, it's getting to, like I said, the whole person to try to
Right.
figure out what's going on with this individual to get them healthiest.
Sure. So we went over this, but I want to reiterate. So it's usually weight,
Hormones, weight, sexual
Sex
health,
drive,
sex drive, painful sex, pelvic pain.
sleep.
Contraception is very important in
Yeah.
40s and 50s, perimenopausal. Sleep issues are huge.
Yeah.
Metabolic, thyroid.
Yeah.
Mhm.
Thyroid. That's
Mhm.
a buzzword that I've been
Mhm.
hearing. I mean, I
Mhm.
feel like since I started moving here, a couple of the students here, my thyroid.
Mhm.
What's the condition that affects the thyroid?
There's
Okay.
hypothyroidism, which
Yes.
is like a sluggish thyroid. There's hyper, which is too overproductive, but most
Right.
people aren't there. And then there's Hashimoto's thyroid.
Hashimoto's. That's
And that's
the
an
word.
autoimmune, like antibody kind of
Yes.
disorder.
Yeah.
Mhm.
Okay. Ova's name and mission have so much warmth. How did you land the name Ova?
Well, you know, we are from eggs. We come from eggs,
Mhm.
and women are what bring life to this planet and
Mhm.
world. And I thought, what better, you know, title than to say, like, hey, we all started at one point from something as simple as an egg.
Yeah.
And it's meaningful to me.
Mhm.
The logo actually for OVA is based off of my connection to women's health and, you know, feminine energy.
Okay.
And it's actually based off my own tattoo, which is actually the symbol of the logo.
Okay. Where is the tattoo? Can we
Hey
see?
now.
Oh, we can't. All right. It'll be too
It's covered
complicated to
right
show it,
now.
but
Yeah,
no,
yeah.
I'll look on the break.
Yeah.
Okay. And is ova like Latin for egg, or is it another language, or is it just like a root?
A root.
It's a root.
Mhm.
Okay. All right.
Mhm.
Speaking of, just give us a little bit of history, like where you grew up, your husband, your kids. We only have about a minute. So that's a
So originally from Cleveland, Ohio.
okay.
Up until, let's see, we moved here probably about 13, 14 years ago now.
Okay.
What kind of drove us to North Carolina is we always talked about living in the Carolinas, my husband, DJ, and I,
Mhm.
and we just never got down here.
Mhm.
Life got away from us, you know, started with jobs and children, 4 children later.
Yeah. 4 kids, guys. Oh, speaking of ova.
They were working well,
Yeah,
those
they were
ovas.
working well.
And then DJ was actually traveling down here. He was a consultant at that time working for Deloitte.
Okay.
And they actually put in the electronic health record for Novant.
Oh, wow.
So
Okay.
he was traveling down here for like 2.5 years, and the kids and I would come down and spend some time down here. And I'm like, you know what? The market came back.
Yeah.
Morgan was transitioning. Our oldest was transitioning to middle school. So we said,
Perfect
let's see if this is going to work.
All right. We're going to transition to our break, guys. Next, we'll dive into what OVA does differently, why true balance means looking at the whole woman, not just hormones. So don't go away. We will be back in just a few here on The Good Soul. This segment of The Good Soul is brought to you by Erin Fisnick, certified luxury home specialist with Ivester Jackson, Christie's International Real Estate. Erin serves all levels of the greater Lake Norman region real estate market, and whether buying or selling, she is very much the lady who will deliver like no other. Many of us at Good Soul are also really happy clients. Erin can be reached at 704-728-5657 or reach out to me and I'll get you guys connected. Thank you, Erin Fisnick, and thank you guys for tuning in and supporting The Good Soul. Welcome back, everybody, to The Good Soul. We are on episode 80. I cannot believe it. A new decade. Hormones, health, harmony, and finding balance in midlife with my friend, Liz Skalsky, who I adore, her and her husband and her children.
We love you guys.
Oh
I mean, we've been here 10 years, I think, in the studio.
Unbelievable.
Yeah.
Yeah, you guys are fantastic.
And Brett.
And
And
DJ
Brett.
too.
And
DJ.
DJ.
Brett too. Her
Oh,
son
those
is
boys
helping
too.
Shout
Maddie.
out to Brett. Help him
Shout out
out.
to Brett. And DJ is just your husband is such a unique individual.
He is a light.
Yeah, he's a light like no other. And I think we talked about him being maybe not on the podcast, but there are some things that he and I like. I'll bring up a topic randomly in class and I'll walk out and say, Patty, I'd love to talk to you about that.
You should totally
Anything random.
pull him into this.
I would love
Yes,
to pull him
yes.
into it. All right, so let's talk
Let's
over
do it.
here. So hormones, metabolism, thyroid, and stress, they're all connected. So how do you explain that connection in simple terms?
As women, we're very complex people. Hormones run a lot of our metabolic controls, and stress plays into that as well. And what happens in midlife for a lot of women is we start to see this transition when our hormones start declining in perimenopause and menopause. The loss of estrogen actually will start impacting your insulin resistance and insulin, and that will in turn, increase cortisol and stress levels, and that will plummet to weight issues and the inability to really metabolize the way we're supposed to. And it's just, a difficult stage. And, women, I believe, try their hardest to kind of combat this change.
Oh, yeah.
And I just think we need to do a better job in healthcare to, not just do the traditional type of let's check your thyroid and, that level's in normal range. Well, what does normal range mean? Normal usually doesn't mean optimal.
Okay.
So,
wow.
trying to, do a more of a functional medicine approach on medicine is what OVA does. I blend traditional medicine with functional and know that every woman is so different. What is going to work for one, you may have to do a completely different approach for another, but that's where when you have that time to focus and get to the nitty gritty of the core problems, we get to that. It just takes a little time.
You call your model integrative gynecology. What does that look like in real life, day to day?
So integrative gynecology day to day is looking at the whole woman, looking at her family situation, looking at the stressors in life, looking at sleep patterns, looking at what they're doing for diet, what they're doing for exercise, their past medical history, just putting the whole thing together, but really looking at that person as an individual, not their disease or not their, I just want to lose 20 pounds.
Or not just as a stat, like a 42-year-old woman.
Right. It's just like you and I are talking. Like, I want to get to the core of, what is driving your concerns? What is driving your health,
Sure.
difficulties?
So take me through the process when I come to see you. Is there a certain line of testing that you use, or have you developed your own? How does that all work?
It's a blend of traditional labs and functional medicine labs. So typically I try to get the lab work even before you see me for your first visit. That way I already know walking in, we have a good base of, you're not anemic. Your thyroid is already, I can see, sluggish. You have insulin resistance. It's getting to these deeper things ahead of time so we can guide you on that first visit to really get to what's going to help you get healthier.
Okay. So interesting you brought up the word anemic because I just recently found out that I was anemic.
A lot of women are walking around without a clue.
Oh my God. So I went to the doctor, got my testing. So I finally said, can I just get an infusion? I was eating beef. I was taking Mary Ruth's iron supplement. And I didn't realize how, short story long story short, I should say.
Either way.
They send me to the infusion place and it was like rattling because it was the cancer. It was basically where I was next to people who were
You're
getting
in a
chemotherapy.
hematology area.
Yeah, exactly. And it was so, I was like, maybe you want to change that voicemail the way you said, like when they left me the voicemail, I was like, can you use another word? But
Yeah.
it's crazy.
Yeah, it's
But
scary.
anyway, I feel like a teenager now. It's been, so I had to get 2 infusions, 2 weeks. I did not realize how tired I was and how, like, I just texted him this morning and I was like, I just feel so happy and so different and so alive. Would you consider that a hormonal issue, or it's just something you need to know?
I think it's something that all women need to be checked for, and we're not getting checked for it. No one's checking like your ferritin level and a total iron panel. You know, they might be just checking normal blood work just to make sure your hemoglobin and hematocrit are okay.
Yeah.
But we're missing some key pieces.
Yeah. Well, my hemoglobin was a little, not terribly low, but slightly low too. But I'm going to go back for more testing.
Good.
But it seems like the main component to all of this is estrogen, would you say? Is that like the number one?
It's hard to break it down and just say there's one hormone that's, most important. I think, we've been hearing a lot more about estrogen now in the news. And, it was a great kickoff to Nurse Practitioner Week this week because the FDA just announced this week officially that they're pulling the black box warnings off of vaginal estrogen.
Wow. Why? What? Explain that.
So basically, for the last, I don't even know how many years, 20 years or so since the Women's Health Initiative came out, which is a study that scared
Yes.
so many women for the last 20 years that hormone therapy was linked to breast cancer and cardiovascular issues and things like this. And because of there's true things in that study, there are also false things in that study that were misinterpreted and put out there in the public, and that's why we've heard that hormone therapy, like, avoid it at all costs. It's not safe. You're going to get breast cancer.
Interesting.
So I think that's what led to this FDA warning label that they put on hormone products. And we know that vaginal estrogen is completely safe because it really does not even go systemic in the body. It's really targeting the vaginal tissues.
Okay.
Which, keep those tissues healthy as you age and will lessen the chance that you're going to have pain with intercourse and vaginal dryness, which will then impact your sexual life and your family life.
Yeah. Sure.
And, also it'll cut down on vaginal infections and urinary tract infections. So, urogynecology is finally, them and women's nurse practitioners and physicians across the country have been saying, like, we need to do something about this label. Like, this is scaring women unnecessarily. Yeah. So that just came to light this week, which is
great.
so
that's
exciting.
Really exciting.
So exciting.
That's really exciting. So how do you go about prescribing once you get the test results back? What kind are you using product lines? Are you like...
So it's nuanced, because I definitely will pull in, supplements first. I'm going to try to target and talk about, how are you sleeping? How are you managing stress at home? Mindfulness techniques and different things like that, exercise, and then supplements. And then, based on what we need to accomplish, then the next step is usually talking about something that's hormone replacement therapy. And that could be estrogen. It could be progesterone, and it also could be testosterone. So back to those hormones, when you said estrogen, everyone's talking estrogen. They are, but we should also be talking progesterone and testosterone because those are equally important as well.
Are you going to administer the pellets in your practice?
I do not.
You do not?
I do not do pellets because research has shown that those levels can go too therapeutic.
Okay.
So over where we want to be.
And
so
then would I like grow a beard or something?
You could. you could. And you could have some other health consequences, affecting like cholesterol levels, and hair loss is big for women. So when we're doing hormone replacement therapy specifically for like testosterone and different pellets like that, they can go too therapeutic. Then you start getting symptoms of hair loss, acne,
I didn't know
things
that.
like that.
I do take a testosterone, but mine is like a gel.
Yes.
Almost.
Yeah. So it's like a compounded like cream or gel.
Gel. And I put it every other inner thigh, every
lather it up there.
But I'm not
Hey,
that
now.
good with it. Like I'm not really that good about it because I don't really feel that impacted by it. Like I don't feel like a direct result. I probably should.
What do you mean?
And you
don't
might want to check your level too, because
know, I have to.
maybe you're not in that therapeutic range yet. So then
Yeah.
you might just need a little bump.
Oh, Liz, I'm definitely coming in and scheduling. There's no question.
I know. I approve of like the anything topical. You can do troches, which are little like sublinguals, even injections, but at a very low microdose for testosterone. But pellets, I typically try to avoid.
Pellets not your thing.
Not my thing.
Yeah, guys, believe it or not, we have to wrap up the second segment already. Time flies when you're having fun. So people, don't go away. We'll be back for our third segment where we're going to talk about what every woman wants to understand: weight, energy, and metabolism. Dun 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 dun. Like, don't go away. We'll see you. Want a little bit more rainbows and unicorns in your life? Start your day with Good Soul Daily. Every morning, you'll find me in your inbox where I share a quick story, lesson, or quote to spark joy and inspiration. Come join our hundreds of daily readers and let's step into our new day together with my lighthearted, Pollyannic approach. I would be honored if you'd allow me into your heart and head where you are sure to be delighted and inspired. Text me over your email address to 704-618-7993 for your daily dose of happiness and reassurance that life is pretty darn awesome. Welcome back to The Good Soul, everybody. I am here with Liz Skalsky, and we continue on this journey through the hormones.
Yes.
Let's talk about metabolism now. Metabolism naturally slows at 40, I would guess, on the average, but it's not all downhill. What's really happening to our bodies at that stage?
So with our declining hormone levels, specifically estrogen is linked to your insulin resistance. So when that starts to shift, it's more of an uphill battle for metabolism. And, what you could maintain your weight at for the same calories and the activities and exercises you were doing, you're going to find that things stop working.
Things change.
And it's that core deep metabolic, change that's happening that really starts the cycle for women in their 40s and onward.
Are there any metaphors that you can give? Like the hormones are the gas and this is the car, versus the insulin. Like what's the connection between estrogen, testosterone, and progesterone
and all the hormones?
Yeah.
I think they're your even levelers. They kind of make all your hormones function and flow, and the energy uptake in the cells, they're more sensitive when your hormones are there. And when we start to see those declines, that sensitivity, is not there. So then you start to see that imbalance.
And they're more sensitive, and your body basically just isn't working. It's not running at full throttle.
Yeah, right. And then you throw in sleep deprivation, high stress levels, just everything that's so difficult. That is just extra fuel to the fire of throwing that dysfunction off even more.
Yeah. Oh, yeah. Thyroid and insulin changes can make women feel stuck or tired. What are some signs that hormones or thyroid might be to blame?
Well, definitely weight changes. So if that thyroid is getting sluggish, you're going to start seeing, weight gain, dry, brittle hair, nails, and not just dryness from the weather. Like there's clearly a difference in how women's skin and nails feel. Hair loss, which could be tied to also low iron and other conditions as well.
So crazy.
It's all interconnected. That's the hard piece.
Counts.
Everything is interconnected.
Well, what's interesting to me is how none of this has ever been discussed, like with our mothers and our grandmothers.
Right.
How did this all kind of start coming to light? Do you know anything about the history of how this topic became
Perimenopause and menopause?
Yeah.
I think what we're seeing, there's a revolution for women. We're always the caregivers. We're always the doers. We're always the ones that, have for the majority of our life kind of have to go with it. And it's just what it is, and you do.
Yeah.
And I think now that we're seeing, you know what? We don't have to feel crappy in perimenopause and menopause. We don't have to be told it's just a normal transition.
Yeah.
Suck it up.
It is.
Suck it up, right?
Suck it up.
And, there's also been a shift in medicine, healthcare, and women's health in particular, that more women are going into the field versus the paternalistic side that it's been for all these years.
Yeah.
More.
So now, there's like women taking care of women and saying, no, this is not something you have to live with. We can actually make this better. You can feel better.
Have you had to treat yourself?
Yes.
All right. So
I am wearing my estrogen patch. I did. Yeah, absolutely.
Tell me about your experience.
So,
if you don't mind me asking,
no,
your
absolutely
age,
not. So I'm 48.
You're 48.
Mm-hmm.
Okay.
Probably about 2 years ago, I started to have horrible changes with like anxiety. And out of the blue, I started having panic attacks.
Oh, I'm getting emotional.
So, I think if you look at my history, I really didn't ever think I had anxiety. I never was diagnosed with it early on, but there was probably some, sprinkles there. We all have some neurodivergent tendencies in some ways. And perimenopause can put fuel to the fire for those symptoms.
So peri is like pre-menopause?
Peri is pre-menopause, and that can start in your late 30s and can go all the way until you go through menopause, which by the technical definition is 12 months, no period. And that's typically around 51 and a half is the average age.
So at that point, did you go for hormone testing?
I did. And, the difficult thing is perimenopause has even less research than menopause. So we have this gray zone of what do we do for these women that are horribly symptomatic in their 30s and 40s. No one has wanted to touch women with hormones, right? Because of the concerns and safety things. Now we're finally getting to the light of, we know these are safe, especially, if you're monitoring patients, monitoring their levels. So I started on progesterone first because progesterone is our calming hormone. Okay. It impacts those GABA receptors in the body. It also helps tremendously with sleep. Oh, okay. So it's kind of like the calming hormone for the female body. So I started on that, and it got a little better. And then what really kind of pushed it over the edge of feeling like instead of these ups and downs, huge radical shifts in anxiety and panic and worry and
terror,
not feeling clear mentally, like just feeling like, am I losing my mind? I can't even remember what I was just talking about. Little things like that, blurry. And it was actually the estrogen, which I'm on in perimenopause, which is not your traditional treatment route, but it's leveling out those troughs. So instead of having these big ups and downs, it's kind of keeping things more steady.
Do you feel so grateful and different?
Yes.
Almost like grateful that you went through it because now you're like,
that's
so happy.
And that's what led me to say, you know what, this is what I want to specialize in. This is kind of like my next little adventure in life. Like I want to focus my care on perimenopause and menopause and sexual health because I know if I was thinking this is just me going crazy, that everyone else out there is feeling the same probably.
It's so funny, Liz. I'm going to Mexico on Sunday for a week and I'm going to be knocking at your door on Monday morning because I have to say, like, this is the iron. I have been dealing with the same thing. Not so much panic attacks, but melancholy and worry and shame all the time.
Losing the lust for life. Like not, like I used to want to go out and do things. And now I'm like, nah. And there's that, it's just, it's an interesting transition for women and a scary one.
For sure. Well, for me, like the iron was like, for me, that was my, like the iron infusions. Like I'll say it again. I just randomly texted him this morning. Like, I'm just so happy. And the gratitude is overwhelming because it really is torture. I remember seeing an interview. It was Oprah interviewing Holly Berry. I
Mhm.
saw a reel, it was probably a few months ago, and
Mhm.
Holly Berry was saying menopause is awful. It's
Mhm.
horrible. But here's the silver lining. When you get through it and you
Mhm.
conquer it,
Mhm.
you are never happier in your life
Right.
than you ever
Right.
were. So
Right.
they say the older we get, the happier it gets. So hopefully that's going to
And I
be
think
kind
we're
of like,
seeing this transition where, menopause and perimenopause shouldn't be like this horrible stage we have to go through. Like, I think culturally we should try to embrace it as like a new awakening to this new, stronger woman that now can like do so much more because we've kind of gotten over our things in life that
sure.
have been struggles.
So basically, in like summary, is we just want to find out what our levels are
Mm-hmm.
and see if they're off,
Mm-hmm.
and then kind of compare that with our symptoms
Mm-hmm.
and
start figuring out between supplements and lifestyle changes and hormones how we can make women feel better.
oh, you hear that, guys? Put that in your pipe and smoke it. How about your colleagues that you worked with? How do they feel about what you're doing?
Everyone's like, wow, good for you. Like,
Mhm.
you're a little crazy going out and doing this on
That's
your
all of
own.
us. We're all crazy.
Yeah.
But we're all a little crazy. And I just, I want to give good care. I
Yeah.
want to have the time to deep dive into getting to the root.
Yeah. Well, I'm really excited to get with you personally, selfishly, and I can relate with the studio and people coming. I always
Mhm.
say they crawl through the door and they're doing cartwheels out
Yep.
the door in literally 1 hour, which it's a quick fix and it's not permanent, but it is really rewarding for me.
It's a release.
Yeah,
It's
well,
great.
And
and
you
it's-
are helping women feel so good about themselves.
Well, they're helping themselves. They're helping me make a living, and yes,
In the community.
we're all
and-
helping each
and the
other. But this,
community, yeah, it's a
we have to lift
win-win.
each other up.
Yeah, absolutely. So, guys, we're there. Segment 3 in the book. We'll see you for segment 4 here in The Good Soul. Don't go away. Who isn't looking to get happy and healthy and empower themselves in an extraordinary fitness community? At Good Soul Hot Yoga, we offer life-changing yoga, strength training, cycling, and relaxing therapeutic classes that will make everything in your life feel better. For some power, balance, and peace of mind, we will deliver. Come experience our spa-like wonderland in the center of Mooresville. We will become your happy place. Hey guys, welcome back to The Good Soul. We are talking hormones, health, harmony, and finding balance in midlife. So let's get down to the good stuff.
The good stuff.
Sexual wellness and redefining. Manny's like, I'm going to leave the room for this segment. He gets all embarrassed. Up to 80% of women experience sexual changes during menopause.
Mhm.
Why do you think so few are comfortable talking about this and fixing it?
Where do we start, right? I mean, I think depending on where you grew up, what kind of cultural background you have, what
Sure.
the views were on sex.
Mhm.
In the South, maybe it's considered a little bit more dirty sex and things like this
it's
down
dirty.
here,
Yeah.
Whereas the North might be a little bit more open. So it's very different on based on what you came from
Mhm.
culturally. So I think that imprints a lot in women,
Yeah.
so they may not, be as open about talking about,
Their
what they
challenges.
want and what they even want,
Oh,
like
yeah.
requesting things like, I would like to try this or
Mhm.
let's do that. So,
Yeah.
and then,
Wow.
you shift, the hormonal changes into that. And then, women will start to have lower sex drives with their hormones dropping.
Mhm.
And you'll start getting vaginal dryness and
Yeah.
pain with intercourse, which is a huge problem in these
Yeah.
years
Because of the dryness, you would say.
because of the dryness. That's
Yeah.
because of the loss of estrogen to
Yeah.
the tissues down there. And if you can take anything from this today,
Mhm.
any woman in their 40s that is starting to have issues with vaginal dryness and pain with sex, please go start on some vaginal estrogen cream.
Yeah.
It is safe. It will prevent you from having worsening symptoms as
Mhm.
age and menopause progress.
Right.
And sexual intimacy in relationships is so important. And, women are afraid to speak about this.
Yeah.
Their
So
providers aren't open with this
that was the
topic.
black label you were talking about.
That was the black label
You
on the
can buy
vaginal
that
estrogen.
on the shelf in Walgreens?
No, it's still a prescription.
Okay.
But I encourage all women to talk to their providers and request it.
Yeah. So how is it? Like, do you feel like male doctors, I guess it just depends on the doctor.
It just depends. And, we've had a 20-year span of people not being comfortable prescribing hormones. So we have this lack of knowledge-based people and this fear that's been put out there.
Mm-hmm.
So I think that is a deficit to women having access to hormones and vaginal estrogen cream because people were afraid of using it.
Why do you think that, and we don't have to get controversial at all, but like, why do you think that those studies weren't revised and we weren't informed 10 years ago? Why did it take so long for this label to come off the box?
I really think that it took enough voices of, patients in the community,
Mm-hmm.
caregivers, saying like, listen, I've been using this and these women are doing great. They feel wonderful.
Yeah.
I'm not seeing, these side effects, these things that...
And the studies are probably showing that these women aren't getting breast cancer.
And what the problem with the Women's Health Initiative study is they started looking and treating these women when they were postmenopausal.
Okay.
And the risks don't line up when you're postmenopausal versus when you start hormone replacement therapy in perimenopause and menopause.
Mm-hmm.
So the North American Menopause Society recommends that if hormone replacement therapy is indicated for a woman to relieve their symptoms,
Mm-hmm.
it should be started within the first 10 years of menopause.
Okay.
That's the safe zone. That's nuanced. There might be a little before that and a little after that. It's based on the risk, for that person. But if you start it early, it is safe.
What would make it unsafe if you started it too late?
There's a little bit of higher risk of like blood clots and strokes.
Oh,
and
wow.
there isn't that protective benefit for cardiovascular health.
Okay. It's funny because you mentioned something, and I love hearing statistics like you have to really look at
it's so nuanced.
the big picture. And I know, like, I forget what it was. Like, let's just say, we took 100 marathon runners and like gave them blank in hopes that blank would happen. And then, but if you're running marathons, great things are going to happen anyway. So wouldn't necessarily, most people who run marathons don't smoke cigarettes. They don't drink alcohol on a regular, so, and I love it's really so important to look at the study and who's funding the study too.
Exactly.
That's huge.
Yeah,
That's huge.
exactly.
Okay. So you treat sexual wellness as part of whole body health. What does a holistic approach to sexual health look like?
Evidence-based, trauma-informed, knowing who's sitting in front of you, if there are any traumas, and mental health struggles that are impacting their sexual health as well, on top of these hormone changes and body changes that happen to us as we age.
Right. Okay. Really, really interesting, all of the things that come into play. And I'm thinking back to when you were talking at the beginning of the segment. It's also like we were talking about anxiety and my melancholy and stamina in life and exhaustion.
Right.
And there's all these other elements. And let's face it, like men have to deal with their challenges too sexually.
Absolutely.
I mean, the purple pill, right? They need it.
We're gonna get one. We're gonna get one for women.
The blue pill.
The little blue.
Oh, we are gonna get one for women.
I think it's on the horizon.
Oh, wow.
I think it's on the horizon.
That's really interesting.
Yep. Mm-hmm. Not soon enough though. We have so many like different modalities for men and testosterone replacement therapy for men. We don't have a single FDA approved testosterone hormone replacement therapy for women.
It's so crazy. Yeah.
We're getting there. We're getting there.
Confidence grows when women understand their bodies. How do you help patients reconnect with confidence and joy? Can you make me your guinea pig?
Yes, please. Come in. Baby steps. We have to look at your whole person and, your mental struggles, your physical struggles, and know that, your health and your hormones probably didn't decline quickly 3 to 6 month period. This has
Mhm.
been happening over time.
Mhm.
And I want you to give grace to your body. Don't come in expecting a miracle day one. This is going to be work on my part and your part. We have to work as a team to figure out all the boxes we have to check to make your health back to, feeling great.
Operating at its
Mhm.
best.
Yep.
Sure. Do you work with their medical records? Like, do you say, like, have you been to the doctor lately? Can I get an update or anything like that?
I work with it all.
You
So
work
I
with it
will,
all.
yeah, I will look through all their past medical history. They will give me I have very detailed intake forms, to kind of get even more in depth than your standard office visit, especially if women are coming in for hormones or sexual health.
Mhm.
They're now asked nuanced questions usually to get to the core problems. So I think it's deeper understanding at the core of that whole person
Mhm.
and trying to figure out all the different pieces that we have to do to tie into making them feel wonderful,
Whole again. Yeah,
whole again.
wonderful. So do you see in the horizon, or on the horizon, I should say, what you're doing becoming part of traditional medicine? Like, would you hope that they'll align with you?
I definitely hope so. And I think that the trajectory is, now with these new announcements we've had this week, and there's this new light and energy that's getting put into women's health care and
Mhm.
hormones and sexual health. So I really, really think we're kind of shifting to this new paradigm.
Jump
Yeah.
on it, though. You
I was
know,
just
you
going
know,
to say
you
Yeah.
that. I
do
was going to
something,
say, I'm
because
like,
this
who
is
do I know that's high up in the
Yeah.
medical?
Yeah.
Like, I feel like there's really, I mean, I don't want to say so many people, I don't want to say there's a market out there, but I don't think there's a woman I know over, I would say 45 years old,
Mhm.
that we don't have some version of a hormonal,
Something.
testosterone, metabolism,
Metabolics,
thyroid.
Now
yep.
they're talking about it. Now's the time, like she said. I'm telling you, they're pushing them all last week and the week before.
It's in the
Actually started.
news.
Yep.
And it's all
It's in the news.
You got to jump
Yep.
when it's in the news. Publicity is good publicity. Any publicity.
Any publicity.
Absolutely.
So, Liz, where can we find you? Tell me your website. I will put a link in the description.
Yeah, absolutely. So the website is ovawomenshealthcare.com. And I work out of Soul Wellness, which is a medical co-op community in downtown Mooresville. And my office is located there. And
It's in the Marina Mill building.
Yeah, Marina Mill building. It's a wonderful environment. We have a whole kind of like integrated functional medicine and traditional medicine approach to people that are in that office. So you'll have acupuncturists, you'll have, estheticians, you'll have nutritionalists. I mean, we have all the people that can put you back together, all in our own little specialties, like one little,
Do y'all work together at Soul Wellness? Is there ever group meetings where you say like, oh, well,
we try to.
Yeah.
I'm newer there, but the other night I was just invited to this pranic healing.
Oh, okay.
So, and that was a wonderful thing.
What is that, breath work?
So it was more energy work. So
okay.
there's Reiki and there's pranic healing. Reiki is touch affiliated, whereas pranic healing is more energy, just coming. So yeah,
Never heard of it.
It's just, health isn't just, taking a pill. Sure. Or, it's really the whole entire person.
The whole picture.
And sometimes you have to not do the traditional approach.
Yeah.
Do something more, Eastern medicine.
What a perfect note to end on. So guys, you will find Liz online. You will come to me if you have any problems. You will get panels done before you go in, and you're going to go in, and for a very fair price, I might add. Liz is going to help change your life, ladies. So thank you, Liz, for being here today. You were fantastic.
It was
as
a pleasure.
Always. Yeah,
thank you so much.
Yes. Guys, we'll see you next time. We're coming up on episode 81. I can't believe it. So like, follow, share, and don't forget, comment, please, and keep coming back, and we'll keep bringing you the good stuff here on The Good Soul. Thanks for being here. Wow.